So there's a lot of studies going on at the moment in London about the potential benefits of, or not actually. Before we get onto that, during your PhD, what kind of findings did you make on the because the impression I got when you explained in the email was there's a lot of it was to look at if cannabis does cause mental health or different drugs can cause mental health issues. Now, a lot of the studies going on in London at the moment I want to go into after are looking at the positive effects they can have to aid. So was it was that the case of your studies initially to look at if there are potential cause and relation, and then now you're kind of interested in the kind of opposite of that, if there are potential solution or aid?
Yeah, sort of. So there's drug use is much higher in populations with mental health problems, sort of quite widely, particularly cigarette smoking is just much higher, particularly in patients with schizophrenia.
Right.
But it's trying to understand whether people are trying to sort of alleviate some of the symptoms that they're suffering by taking drugs, or whether the drugs are having are a risk factor for the mental health problems, or both. It's quite possible that it could be working in both directions. So using the drugs could increase your risk, but also it could sort of alleviate some of the symptoms as well.
It's always such a tough area, particularly with mental health, because as you said there, the beauty of that study is that someone had the foresight to carry it through for 25 years. The horrible thing about often a lack of understanding of mental health, or not even lack of understanding, but the individuality of mental health, that each case is so individual, is it will generally be, right, we're going to try these drugs, and we can't just try them for a week, we need to try it for a while, and we might find at the end of this that it's not had any effect, or it's had a negative effect, so now we need to try something else. And it's that heartbreaking thing of it's a catch at 22. You can't find out if it's going to work unless you stick with it for a certain amount of time, and then if it that doesn't, effectively you're back to square one, which isn't and mental health aside, any kind of health, it's horrible to do something for a year or 2 years and then be told, right, that's not worked, what next? So the last 2 years have been essentially all for nothing kind of thing. So as to what next? So I guess there's no, I'm assuming you didn't come to a conclusion at the end of, yes, here is the effect, because as you've touched upon numerous times here, it's a case by case thing. It's a cause and effect. It can go both ways. Yeah, I think what I sort of described earlier about the problems of just observing people, and that you then have to try and take into account all of the other differences between them, that means that this kind of study design is never going to be definitive. So I thought really hard. I read loads of literature about all the other things that might also be sort of confounding this relationship between the two. But you can never be 100% sure that you've thought of everything. There might be just something that you either haven't measured or haven't thought about that's having an effect on both of them. And if you can't exclude that, then you can never be sure. This piece of fiction is the intro to distraction pieces. This piece of fiction is the intro to distraction. This piece of